What is positive recession versus negative recession? So in this case right here, this is called positive recession. I'm positive that there is recession. You can see the gingival margin is below my CEJ. So in positive recession, which is just normally what we call recession anyways, when we're like, there's recession, this is how we're measuring it. It's actually called positive recession. You take your probe depth, which in this case is 4 millimeters, and then you're going to add your recession, which is 2 millimeters. And that's going to tell you where your clinical attachment level is. This right here is what we care about the most. This junctional epithelium is supposed to be not 6 millimeters of clinical attachment loss of our clinical attachment level. It is supposed to be up here at my CEJ. When it's up there at my CEJ, my clinical attachment level is at 0. So how do we know how much clinical attachment loss or where the clinical attachment level is in negative recession? So negative recession is how much tissue is coronal. So do you see my CEJ? And here is my tissue and here's my margin. So how much tissue here is above my CEJ? That is my negative recession. So to know where my junctional epithelium is and how much where my clinical attachment level is, it's currently down here. To know that, we're gonna have to do a little bit of math. So in this case, my pocket depth is a 9 millimeter pocket. And what I'm going to do is I'm going to take my probe down in here, find where my CEJ is, and back measure how much tissue I have coronal to the CEJ. And in this case, I'm like, okay, there's 3 millimeters of tissue coronally. And I'm going to subtract that from my pocket depth. And that's going to tell me that my junctional epithelium has migrated apically, actually 6 millimeters down. And then that's what's going to help me get my AAP classification. So if I have clinical attachment loss of my clinical attachment level from 1 to 2 millimeters, I'm at stage 1 periodontitis. If I have my junctional epithelium from 3 to 4 millimeters down here, then I'm at moderate periodontitis, stage 2. And if my junctional epithelium is 5 millimeters and beyond, then I'm going to be stage 3 or 4 AAP classification. I know it's a little bit confusing, positive recession versus negative recession, and clinical attachment loss versus clinical attachment level. But hopefully that helps your understanding just a little bit more.